Ask most people what kidney disease feels like, and they will usually say back pain, trouble urinating, or some dramatic warning that would be impossible to miss. That is the part almost everybody gets wrong. Kidney disease is often quiet. It does not usually begin with pain. It does not usually announce itself with one obvious symptom. It can move along for years while a person feels mostly normal, and that is exactly what makes it dangerous. A lot of people do not discover kidney trouble because they ignored something obvious. They miss it because nothing obvious happened. Their kidneys simply lost function a little at a time. No alarm, no sharp pain, no dramatic moment, just slow change. And while that is happening, your body may be leaving clues somewhere you look every day and rarely think much about. Your fingernails. I'm Dr. Marie Clark, and in the next few minutes, I want to show you 7 nail changes that can appear when the kidneys are under strain. None of these signs proves you have kidney disease. That matters. Nails are not a diagnosis. Blood and urine tests are how you diagnose kidney disease. But your nails can be one of the reasons you finally decide to get those tests done, and that can make a real difference. One honest point before we go further. These nail changes are not always early. Some of them show up when kidney disease is already fairly established. So do not treat this as a substitute for lab work. Think of it as something visible, something you can notice tonight, without waiting for an appointment. Now here is the big idea that makes all of this make sense. Your nail is not just dead material sitting on your finger. It is built by living tissue at the base of the nail, an area called the matrix. That tissue depends on your blood supply. Day after day, your body uses what is in your blood to make the next thin layer of nail and push it forward. So your nails become a kind of slow record of what has been happening inside you. When kidneys are not working well, 4 things tend to matter here. First, protein can leak where it should not leak. Second, anemia becomes more likely, which means less healthy color in the tissues. Third, waste products can build up in the blood and irritate the skin and nail bed. Fourth, under long-term stress, the body slows down less essential construction jobs, and nail growth is one of them. That is the framework. Now let's read the signs. Number 1. Pale nail beds. When you look at a healthy nail, the pink color you notice is not really the nail itself. The nail plate is partly transparent. What you are seeing is blood underneath. So when the blood supply looks pale, the nail looks pale. Kidney disease often goes hand in hand with anemia because damaged kidneys may not make enough of the hormone that tells your body to produce red blood cells. Fewer red blood cells means less oxygen delivery, less color, and less reserve. There is a simple thing you can do right now. Press on the nail of one finger for a couple of seconds, then let go. The color should fade when you press and return quickly when you release. If the color seems washed out to begin with, or it returns sluggishly, that can be a clue that something is off. Now, pale nails by themselves are not a kidney diagnosis, not even close. Anemia has many causes. Iron deficiency can do it, blood loss can do it, thyroid problems can do it, poor nutrition can do it. But when pale nail beds show up along with fatigue, shortness of breath with stairs, unusual weakness, feeling cold all the time, or a general sense that your energy has quietly collapsed, kidneys belong on the list of things worth checking. What matters most is not whether your nails have always looked this way. What matters is whether they look different now than they did a year or 2 ago. Change is what earns attention. Number 2. Brittle nails that split, peel, or break more easily. This is one of the least specific signs on the list, and I want to be upfront about that. Brittle nails are common. Water exposure can do it, aging can do it, repeated hand washing can do it, cold weather can do it. Lots of people with perfectly normal kidneys have nails that split at the tips. So why mention it at all? Because nails are built from protein, and kidney disease can involve protein loss. When the kidney's filtering units are damaged, protein can leak into the urine instead of staying in the bloodstream where it belongs. Over time, that can affect tissues all over the body, and the nails may become thinner, weaker, and more fragile. The key again is not the existence of brittle nails. It is the pattern. If your nails are suddenly more fragile than they used to be, if they peel in layers, if they crack without much reason, and if that change is happening alongside swelling, fatigue, itching, or other signs on this list, it becomes more meaningful. One sign alone is often just noise. Several signs together start to tell a story. Number 3. Deep horizontal grooves across the nail. These are called Bowes lines. They run from one side of the nail to the other, and if they are pronounced enough, you can often feel them before you clearly see them. Slide a fingertip gently over the nail surface, and you may notice a dip or ridge that cuts straight across. What does that mean? It means nail growth slowed down sharply for a period of time. The nail factory at the base of the finger did not stop forever, but it hit the brakes. Something stressed the body enough that normal nail production was interrupted. That can happen after a serious infection, a high fever, surgery, chemotherapy, severe malnutrition, or other major physical stress. Kidney disease can do it too, especially when the body has been under prolonged metabolic strain. What makes these lines so interesting is that they act almost like a timeline. Fingernails grow slowly, so the farther the groove is from the cuticle, the longer ago the slowdown happened. That means you can sometimes connect it to an illness or event from weeks or months earlier. If you notice a single groove and you can tie it to a bad illness you clearly remember, that may explain it. But if you notice grooves and cannot think of any obvious reason your body would have been under that kind of stress, that is worth paying attention to. Number 4. Shiny, polished-looking nails. This is the surprisingly common one, and it fools people because it does not look like damage. It can actually make the nails look smoother, glossier, even better groomed. No one sees shiny nails and thinks kidney disease. Most people think healthy, clean, or well kept. But that shine can come from repeated scratching over time. As kidney function declines, waste products that should be filtered out can remain in the bloodstream. One of the ways that can show up is persistent itching. Not the occasional itch everybody gets. I mean ongoing itching with no satisfying explanation. It may be worse at night, it may move around, it may happen on the back, arms, legs or trunk, and often there is very little rash to show for it. That is why so many people dismiss it. They blame dry skin, the season, detergent, aging, stress, anything except their kidneys. Then they scratch, night after night, often half asleep, and over time the repeated contact smooths and buffs the nail surface. The free edge can look worn down and rounded, almost as if it has been lightly polished. So if your nails have become oddly glossy without polish, and you also have a long-running itch that never quite makes sense, do not ignore that combination. Chronic itching can have other causes, of course: liver problems, skin disorders, medications, allergies, nerve issues. But persistent itch with no clear rash is one of the classic complaints people describe when kidney disease is more advanced. Again, the shine is not the problem, the itch behind it is what matters. Number 5. The disappearing half moon. At the base of many nails, especially the thumb, you can often see a pale crescent just above the cuticle. That is called the lunula. It is basically the visible front edge of the nail matrix, the part of the nail-making tissue you can actually see. In some people, that pale half-moon becomes less visible or seems to vanish. Now, let me make this fair and sensible. Not everybody naturally has a prominent lunula on every finger. Some healthy people barely see one at all. So this is not about comparing yourself to somebody else's hands. This is about noticing a change in your own. If you used to have a visible half-moon on the thumb or several fingers, and now it is hard to find, that can reflect slowed nail growth and chronic systemic stress. Kidney disease is one possible reason, especially in people with other kidney-related symptoms or known reduced kidney function. This is not the strongest sign on the list. It is more of a supporting clue, but it matters because it fits the same pattern we keep seeing. When the body is under enough pressure, it spends less energy on things it sees as non-essential. Nail production becomes less robust. Features that used to look distinct can become faint. By itself, a missing lunula should not frighten you. In context, it can still be useful. Number 6. Spoon-shaped nails. A normal nail has a gentle curve. A spoon nail flattens out and then dips inward in the center so it can almost hold a small drop of water. The medical term is koilonychia, but the shape is what matters more than the name. When people hear about spoon nails, the first cause doctors think of is iron deficiency. And that is exactly why this sign belongs here. Iron problems are common in people with chronic kidney disease. Some lose iron, some do not use iron efficiently because chronic inflammation interferes with the process. Some develop anemia from several pathways at once. So a spoon-shaped nail is not a specific kidney sign. It is more like a flag that says your blood work deserves a closer look. If iron is low, you need to know why. In a younger person, the explanation may be straightforward. In an older adult, it deserves more respect. Slow bleeding from the digestive tract is one possibility. Kidney disease is another. Neither should be brushed aside. Look at the nail from the side if you can. If the center seems lower than the edges, if the nail looks flattened or scooped, that is worth mentioning to a clinician, especially if you are also tired, pale, short of breath, or noticing other changes we have talked about. Number 7. Half and half nails. This is the nail change that makes many clinicians pause, because compared with the others, it is more strongly linked to kidney disease. Half and half nails are sometimes called Lindsay's nails. The lower part of the nail, the half closest to the cuticle, looks pale, dull, and whitish, almost like frosted glass. The upper part, closer to the fingertip, looks darker, often reddish-brown. And what stands out most is the border between them. It is not a gentle fade, it is a fairly clear dividing line. Why does that happen? The exact mechanism is not perfectly simple, but it appears to involve changes in the nail bed from fluid shifts, vascular changes, and pigment deposition associated with kidney failure. In other words, the underlying tissue changes, and you see those changes through the nail plate. That detail matters because this sign does not behave like a stain or an injury inside the nail itself. It does not simply grow out the way a bruise or a white spot might. The pattern tends to stay put because the change is under the nail, not within the nail plate. If you notice that kind of two-tone split across several nails, especially if it is new, that is not something I would brush off. It is not proof of kidney disease, but it is one of the most meaningful nail findings in this whole conversation. Now, step back from the list for a second, because this is the part that keeps people grounded. None of these signs diagnoses anything on its own. Not pale nails, not brittle nails, not shiny nails, not grooves, not spooning, not a missing half moon, not even half and half nails. What nails do is raise the level of suspicion. They tell you whether it might be time to stop guessing and get objective answers. And the answers come from two tests people should know by name. The first is eGFR, the estimated glomerular filtration rate. It is calculated from a blood test and gives an estimate of how well the kidneys are filtering. The second is a urine albumin test, often reported as a urine albumin-to-creatinine ratio. That test matters because protein leakage can begin before kidney function looks dramatically abnormal on a standard blood panel. In simple terms, one test tells you how much filtering function you have left. The other helps show whether the kidneys are actively leaking protein and taking damage. If you have diabetes, high blood pressure, swelling in the legs, persistent fatigue, unexplained itching, or several nail changes from this list, Those two tests are worth asking about directly. There is one more practical thing that belongs in this conversation because it catches many people by surprise. Over-the-counter anti-inflammatory pain medicines can be hard on the kidneys when they are used heavily or regularly, especially in older adults or in people who already have high blood pressure, heart disease, or reduced kidney function. I am talking about the habit of reaching for them often and thinking of them as harmless because no prescription was needed. That does not mean every dose is dangerous. It does mean your kidneys care about the pattern just like your nails do. So here is the takeaway. If you notice one nail change and nothing else, do not panic. It may be meaningless, it may be age, it may be weather, it may be an old injury. If you notice several changes together, or if one of them is especially striking, or if the nail changes are showing up alongside swelling, itching, fatigue, foamy urine, or a steady drop in stamina, then stop normalizing it and get it checked. Kidney disease is quiet for a long time. That is why people miss it. Not because they are careless, because the body often whispers before it ever shouts. Your fingernails may be part of that whisper, so look at them carefully, not casually. Actually look, under good light, compare one hand with the other. Think about what is new, what has changed, what has appeared gradually enough that you stopped noticing it. That is how important clues get missed, not because they were invisible, but because they became familiar. I'm Dr. Marie Clark. If your nails seem to be telling a story, the next step is not fear. The next step is testing. Get the facts, protect the kidney function you still have, and do it before silence turns into damage you can no longer undo.